The philosophy of the Duke Fertility Fellowship program is to create a very well-rounded fellowship trainee. Duke has pretty amazing resources at its availability, and we want to use those resources to give the fellows training in all aspects of reproductive endocrinology and infertility. We pride ourselves in saying that we're putting the RE back in REI. In my mind, even though many fertility programs have become just IVF programs, our fellows need more than that in their tool belt when they graduate. They really need the reproductive endocrine, they need exposure to research, and of course good exposure to infertility training, and we try to give all of that to our fellows. Our fellowship curriculum is really pretty well balanced between research and clinical time. The clinical time is largely spent at Arrington in the REI clinic, although we do have outside rotations. We also operate both ourselves in the OR with our faculty, as well as operating with the minimally invasive gynecologic surgeons to allow for a very broad surgical experience. The research side of things takes place mostly in the second year, which is protected for research. And our third year of fellowship is split between research and clinical, with some flexibility in what you want to get out of the third year of fellowship. So if you're more interested in research, more research. If you're more interested in clinical, more clinical. We have the ability to do research in basic science. In fact, two of our physicians are physician scientists and have their own NIH-funded research labs. In addition to that, we have PhD scientists that our fellows can rotate with. We have the opportunity to do clinical and translational research and have a very strong capability within our clinic to do that. In fact, our associate program director, Kelly Acharya, is training in the CREST program right now to allow her to be an excellent mentor for clinical research. And then we also have the ability to do quality improvement research, outcomes research, and kind of the whole gamut, which is a really excellent, well-rounded research opportunity for our fellows. One of the unique aspects of the Duke Fertility Training Program is its encompassing of many other aspects of REI training. Not only are we seeing some medical endocrine patients having opportunities in peds and adolescent gynecology, minimally invasive surgery, genetics, and a variety of others. We have integrated into our clinic a clinical psychology training program, which is really very special and probably isn't found in many places throughout the country. My hope is shared with all of our faculty, that our fellows will leave with an opportunity to do anything that they've envisioned they want to do in REI. That could be private practice, that could be pure academics, it could be mostly surgical, it could be mostly fertility, it could be mostly endocrine. We want them to have all doors open to them when they leave our fellowship. We at Duke Fertility are proud to be in a new facility. It brings all parts of REI together. We have space for our clinical psychologists, for our geneticists, for our ultrasonographers in our IVF lab. We also have some dedicated space for research to be done just outside of the clinic. And so we really believe it's state of the art in all aspects of fertility.